Sometimes the muscles get mad at you and you are the reason why. I'm talking to us about this in this video. What muscle spasm means, who are those that can come down muscle spasm, why it occurs, and what you can do to help yourself. Hello to you and welcome once again to another video on the Everyday Physiotherapist. I apologize once again for not using a video last week, and today and this week we are back again with another series of videos. I hope you've been learning something for the past few weeks, because today I'll be concluding on the series on back health. I hope you learned something new. Today we're talking to us about muscle spasm and what basically it means. It basically means the sudden contraction of the muscles and tightening of the muscles. Now, who are those that can have this particular condition? Basically anyone. Now, how does it happen? There are three types of spasm that I know of. We have the tonic spasm, we have the clonal spasm, and we have also cramp, which is also a type. Tonic spasms are more of spasms caused as a result of the postures as over a particular period of time, while the clonals are as a result of neurological conditions. Now, there's some particular patients, when they have neurological conditions, they tend to have spasm where there's a sudden jerking of the muscles, or you can even see it when you do some particular tests. And then most people that you see walking normally, that is more of tonic spasm. And how can you tell someone has tonic spasm? Now, mostly it occurs in the back. Not mostly though, but some people tend to have it more in the back compared to the part of the body. Now, I'm going to be explaining, giving us different reasons and different causes of this spasm. We have as a result of reduced blood flow. Now, when blood is not properly being circulated to a particular part of the body, the muscles tend to tighten, and then that place becomes knotted and tight and hardened. Basically, if you try to rub around a particular area, you see that those places are quite bigger than the other one. And it may not necessarily be an obvious bulge, but you feel it. We compare between the left and the right side of any part of the body, so that when you try to graze around it, you see that there's kind of a bump there. So you have that, muscle spasm, and sometimes it's painful. Sometimes some people don't necessarily feel pain, and you may not even know that you have a particular condition until you see a therapist. Recently, I've had people that I see them and then they tell me that they have back pain. Honestly, that back pain, I check their spine, there's nothing wrong with the spine, everything is fine and perfect. They go for x-rays, everything is also fine. But I just do my examination and I realize that, okay, you're dealing with a muscle spasm, you're not actually a spinal issue. So manage that one for them rather than just managing changes that are not there at the moment. For particular patients, sometimes it's as a result of poor posture. We bring me to the second thing, poor posture. The posture you have over a period of time can actually tighten or relax your muscles. Now, what the muscles need to do is just to relax. So sometimes the muscles actually guard when you're doing particular things over a period of time, rather than just trying to give way. They guard themselves by tightening. That's when you find out those small clots. Now, for someone that sits for too long, for too long, for a period of time, you might start having tension here. So your muscles kind of tightening into your neck region. You can find them mostly in neck region and back region. Sit down for too long. Your posture is like this for too long. You can end up having tightening of the muscles anywhere, your neck, your back, and that can lead to pain in the long run. Now, another one can say is dehydration. You can also see another one of nerve irritation, where your nerves are irritated, they get overexcited, and then they also lead to that one is now more of a neurological condition, not a musculoskeletal condition. Last one is muscle overuse. Sometimes we get very, very used to work or used to activities. I'll just forget that our muscles need to also rest in a particular period of times. You walk a lot, you sit a lot, you run a lot, you don't even relax yourself on some days. So that can also lead to muscle spasms. And these things are manageable and can actually. Now, what are the symptoms you can use to tell that you have muscle spasm? It could be in your lower limb, in your calf region, your thigh region, or even in your back or your neck. It can occur anywhere you have muscles and visible muscles. Now you feel sharp pain in a particular part of the body, probably the muscle area, sharp pain. You feel sharp pain, you feel tightening of the muscle, like it's being knotted together. Lastly, the final one is muscle overuse. Sometimes we get really busy at work, or let me know it's what selfish, honestly. You get selfish and forget that our body needs to rest. So you overwork your muscles, you're a sports person, you walk, and train that you forget that you need to also rest your muscles some days. And this can actually lead to what we call muscle spasms. So what can you do and what should you do actually? Now, before I move ahead to that, what should you know about this particular condition? What are the symptoms? I'm talking to us about three of them, and very simple one, sharp pain, number one. You feel sharp pain. So if you feel some embracing the particular muscle and you feel like there is pain and person is pressing the part, yes, you can say that the muscle and it's on the muscle part. It could be a muscle spasm. You also feel tightening around that part, sudden tightening around that particular part. You feel like your muscles are contracting, like they're squeezing together. That's another one. You also feel knots, like they're hardening together. That's when you can now feel those visible bumps around the particular muscle. Okay, most of the time I've been seeing patients with come down with this particular thing and in their backs. So I almost thought it was just more of back because I've been seeing that. But then I saw another patient that also came in and the person actually had in the lower part. Then I realized that okay, it's not just about the back, it's also about any part of the muscle. So I learned something new as well. This particular part can also occur in the lower limb, the legs. So don't just think that just my back or just where I walk, wherever you overwork or overuse a long period of time could actually come down with muscle spasm. So you know what to do on the long run. Now, what can you do? What should you do? I'll run you through some of this. And then one thing you should do is that you could see a physiotherapist. It's very important. Yes, medications can relieve you, very true. But if your medications will leave you, when you go back again or work yourself again, it will return again. That's the simple truth. I've seen patients tell me that I feel better, I use medications, they come back again to the same condition because now they're just trying to do what we call pain relief therapy. They are not addressing the problem and the cause of that thing. So now physiotherapists will tell you what to do, what to avoid doing. It's up to you and up to your physiotherapist to actually run you through and walk you through, ensuring that you follow their guidance, even though we cannot, tell you and say this is what you should do, but we can majorly advise you and put you through steps to help you to live a better life, a productive life. Now, what will I do for you if you come and see me in my clinic? Now, one of the things I would do is that I would help you to relieve pain. Now, can use heat therapy for this particular management or cold therapy. Now, for cold therapy, most of the time I've been switching towards cold therapy because I'm trying to just to numb the pain and then stretch the person. Now, you can also use heat therapy, still works all in all, but sometimes some people feel or get better because of the cold therapy. So it all depends on what your patient likes and which one you also feel like would help the person. Now, for the cold therapy, one of the things cold therapy does is to numb pain. So when that particular part is numb, I can stretch more, I can work on that particular part for a long period of time without person feeling pain. I don't know if you've ever listened to one of my videos where I spoke about what cold therapy does for you when you have an injury. The same thing applies here also whenever you use cold in another particular part. So when that part is numb, I can walk, I can stretch, I can do what people call massage, and I can do that for a long period of time, and the person will feel little or no pain. And then I can also continue, and I can also stretch the person. That stretching will involve the person doing particular movements, and the person will feel better. You could also use heat therapy, but that heat therapy basically allows blood flow to go to the particular part. When blood flow goes there, healing also takes place, the person tends to relax. But that might be a longer period of time depending on what you want to achieve with the person, and how long the person also wants to be seeing you on your face. But it all depends on you. If therapy works, warm therapy works. Another thing I also do for someone else is that the person came down with what was I use cold therapy. I also use ultrasound, which is the modality that we use with therapy, and it basically helps. And the reason is because ultrasound is more of a pain point. I use it more for a patient who has a pain point and pain, and then I work on that particular part with ultrasound. So I use cold therapy, I use warm therapy, and I stretch you. Now, how do I stretch the person? Now, let's say the person has spasm at the upper back or the lower back, any part in the back. I'm done with the cold therapy treatment. I'm done with the ultrasound treatment. What will I do next? Tell the person to try to touch his or her toe like this. I'm so sorry, so try to touch her toe like this, and you're bending like this. So the fact that you're bending, actually, you're stretching that particular part. Then someone is at the back here pushing the person and pulling the person to actually bend over. So you might not be able to touch your toe, honestly, but someone is at your back, I'm at the person's back, pushing the person to actually touch or to be stretched further. And that's how I stretch the person. The person feels better on the long run. So it's all about knowing what works for your patient and what your patient's like. Before I go on, some people do not like cold. So you might just ask, do you like cold? Do you react to cold? Do you react to it? And then you know what to do better. Don't just come in and don't just treat you because you have particular. I need to know what I'm treating and addressing, not just treating you because you have pain. So that's what muscle spasm means and what you can do for yourself. Now, if you're at home and you don't have access to physiotherapist early enough, what can you do? Honestly, you can get ice. When you get ice, just like I've mentioned, when you get ice, you can get any pain relieving cream. Just bring the ice to small action like the told us, and then apply on the skin for on that particular part explaining you for like 15 to 20 minutes. When you're done with that, you can apply pain relieving cream for a period of time, and then after doing that, you can stretch the pain. Would not necessarily go in 1 day or 2 days or 3 days, but we do use it repeatedly and constantly is to actually get better and relief. The person will come down with no pain, and at some point the knots will actually relieve and be released. Now, another thing you also take notice is the person's work habits. Most of the time, people that I see, they tend to that thing that causes pain, and then it's like running through a cycle. So you have to ensure that your patient actually does what you tell him to do. For instance, you tell your patients when you sit down after a period of time, stand up, walk around. So let your patient also know that person can get better. But if you go back to that same thing that keeps making you come back to a particular condition, you will return again and then it might be worse or it might be the same thing. Rather than just treating pain back to back, back to back, back to back. One thing also that physiotherapy is also to advise, like I mentioned earlier, advise you on what to do and how to correct yourself or to relieve pain. That's one of the things that makes us professionals. So I hope you learned something new into this video. I hope you can see that you can manage yourself as to more severe muscle spasm. And I hope you have learned something in this overall series of back health. And that will be all this week. That will be all for now on lumbar health and back health. And that will be all for today's video. Don't forget to like my videos. Don't forget to comment. Don't forget to share. And most importantly, don't forget to subscribe and tell someone that needs to know about their back health about this channel and share the links with them as well. And until next time, I'll see you in the next video. Bye.